Hi everybody, thank you so much for agreeing to participate in my SRC project. I hope that you find this presentation fun and informative. I'm hoping to use pictures of my own horse and my friends' horses to help people understand how to differentiate between similar expressions in horses to understand pain. A lot of people struggle with understanding and applying the horse grimace scale, myself included, so I thought it would be useful to find pictures of the same horse to show differences in facial features when calm versus in pain, and then hopefully we can generalize that to other horses. This is the study that got me originally interested in equine behavior, so I included it here in the hopes that it would pique your interest as well. It's a pretty intuitive concept, but it's interesting to see it represented in a more scientific way. In the study, they took 20 surgical patients and videotaped them, and then analyzed the videos 60 minutes before and 60 minutes after visits from staff in the hospital. And then they counted the videos, the number of times that they saw pain behaviors in those videos, and they made the graph that we see here. And then in the graph, we can see that during the visit, there are a lot fewer pain behaviors, and they have a really low p-value attached to that, meaning there's very strong evidence for this. This concept is pretty well described and understood, but according to the introduction to the same study, they mentioned that it's not widely appreciated in equine practice, which is especially concerning given that all of our pain scoring methods involve the people actually going and interacting with the horse, or at least the horse having seen them in order to be able to score um, the horse's pain. So we have to conclude that the pain signals that we're picking up on are just the tip of the iceberg. I just wanted to include this to highlight the fact that there's many different ways that horses express pain based on the pain that they're experiencing. So there's lots of different pain scales out there if you're interested. Also, it's important to note that behavioral issues can be an indicator of pain. Sometimes naughty horses are actually painful horses, so that's worth having in the back of your mind while in practice. Probably the most commonly used equine pain scale that's used in practice is the equine lameness scale. So I just wanted to include this here for revision. I thought that might be helpful. So just to review, for a baseline lameness exam, a 0 is sound, a 1 is inconsistent lameness, 2 is consistent lameness under certain circumstances, 3 is consistent under all circumstances, 4 is obvious at the walk, and then 5 is a non-weight bearing lameness. Alrighty, this is the horse grimace scale. I realize it's kind of hard to read here. We'll go through each one individually. Each facial action unit is graded based on a 0 to 2 scale, with 0 being not present, 1 being moderately present, and 2 being obviously present. For this presentation, I used pictures of my horse. She tended to be very creative with ways to die, as horses often are. I used these pictures, I took these pictures while I was waiting for the vet, and generally I use them to timestamp different things that I could give the vet an actual history when he got there. So yeah, I wanted to highlight that I wasn't willy-nilly taking these, and I was actually very distressed to see her in such a state. I was also very unaware of the horse grimace scale and unintentionally put her in an adverse state by riding her, maybe when I probably shouldn't have. This was definitely a hard thing to realize when I first started learning about the horse grimace scale, but I'm now trying to do better by horses, and I hope to pass along the horse grimace scale info so that you all can do well by your future clients and future horse friends as well, and hopefully help them identify painful horses. In these first few photos here, she's relaxed and calm. The black horse is my friend's horse Cloak, and he was not painful in that picture, just interested in something off the screen. The first facial action unit is stiffly backwards ears, which they defined as ears that are held stiffly and turned backwards. As a result, the space between the ears may appear wider relative to baseline. In the first picture, she was in the round pen. I got in front of her shoulder to turn her the other direction, which she was displeased about, so I got the resulting image. So she wasn't in pain during that time, but I did put her unintentionally in an adverse condition emotionally, and she is displaying that by demonstrating stiffly backwards ears. Her right ear is also turned a bit towards me in that situation because that's where her attention was. In the second picture, she was 1 out of 5 lame. I thought she was 0 out of 5 lame at the time, but so that's why I was riding her. But after practicing lameness evaluations a bit more on EMS, I realized that she was actually a little bit off. Her facial expression shows that she does feel off. She's doing a great demonstration of stiffly backwards ears for us. And in the last picture, I had a grain bucket that she was trying to get to, and she was feeling what we call food sour. So in other words, she was frustrated that I wasn't giving her food. Her ears are stiffly backwards here too, but the main difference between this one and the others is that her nostrils are elongated in the caudal direction, rather than being flared from exercise and or pain. When horses are very, very acutely painful, their ears will be stiff and turned out. Unfortunately, or fortunately rather, I don't have any pictures of Breezy doing this. It essentially looks like airplane ears, but a little bit more tense. If you look at videos of top competition horses, they frequently have outturned stiff ears, and you can tell that they are stiff and that they aren't floppy because they aren't flopping back and forth as the horse's head moves. To compare, her ears are back here, but it's more because she's paying attention to the horses behind her, but her ears are less stiff, which we know based off of the context. And then here are some examples of pinned ears. She was feeling food sour in the first one. And the second one, Breezy's best friend Maggie was trying to create more space between herself and the other horses. And then in the last one, I was giving confusing riding cues, so she got annoyed. Okay, the next facial action unit is orbital tightening, which is defined as the eyelid is partially or completely closed. She has orbital tightening in the first and third pictures. In the second picture, she has choke. She was acutely painful, and looking back at the videos from that day, she wasn't blinking at all. So I decided to add a hard stare to this. Horses in a more aversive state tend to blink a lot less than horses that are calm. The next facial action unit is mouth strained and pronounced chin, which is defined as a strained mouth that's clearly visible when the upper lip is drawn back and the lower lip causes a pronounced chin. In the first picture, Breezy was in the equine hospital for a severe bout of epistaxis. She wasn't painful in that picture, but was clearly freaking out about being in a new place. Her chin is pronounced, and it looks like she has a second bleb of tissue under her lip rather than her lip and chin being one continuous plane, like it is on the right-hand side. The next facial action unit is tension above the eye area, which is defined as the contraction of the muscles in the area above the eye, causing an increased visibility of the underlying bone surfaces. Most of these pictures come from when her lameness and arthritis were more advanced. I've highlighted where the wrinkles are so that they're a little bit easier to see. It looks like it peaking above the eye. Some horses will also get wrinkles below the eye when they're feeling really stressed. To compare, she was relaxed in all these pictures. Her eyes are bright and wrinkle-free. Her lips in the middle picture are very relaxed, and the muscles just caudal to her lips aren't engaged, and neither are her chewing muscles. Her ears are turned forwards and her nostrils relaxed in its natural position. The next facial action unit is prominent strained chewing muscles, which is defined as strained chewing muscles which are clearly visible and an increased tension above the mouth. Breezy's chewing muscles on her masseter muscle are visible on both of these, and it can be seen from quite a distance, so we know that she was clenching her jaw quite hard. Just to compare, the facial nerve is also visible, but that goes perpendicular to the fibers of the masseter muscle. The last facial action unit is strained nostrils and flattening of the profile, which is defined as nostrils look strained and slightly dilated. The profile of the nose flattens and the lips elongate. In the painful picture, the nostrils are wider and her top lip is pulled tightly against her teeth. Sometimes horses will pull so tightly that you can see their teeth as well. All right, just to look at some examples of a few other horses. A friend sent me this picture when I asked her for painful pictures of horses for this presentation. Unfortunately, I didn't get the context for this one. However, we can tell that the nostrils are a bit wider than the average relaxed horse's nostrils. His upper lip is tense and his lips are pulled back. He has a prominent chin and there's wrinkles and a peak above his eye and wrinkles below his eye as well. His ears are turned backwards. And without the context, it's hard to say if he's listening to something behind him or if they're turned that way because he's painful. But anyways, I would agree with my friend that this horse is in pain. This is a different friend's horse. He was a Frisian and presented to the hospital back home when I was doing EMS over the summer. He presented for colic, and I got permissions from her to take pictures of him, and this is what I got. He has a prominent chin, and his ears are turned out to the side. His eyes are hard and listless. He has wrinkles and a peak above his eye and tension below his eye as well. The nostrils are not relaxed, and he has tension in the muscles of his face, just cranial to the masseter muscle. And then the shavings on his head are also an indicator that he's not feeling super comfortable. I hope that this has been helpful to you. I hope that you've been able to appreciate as well that the context can be really important. If you have any questions, please feel free to reach out to me, and thank you again for helping me out with this study.